Kelly Leviting. I'm doing medication administration. Today is 8/7/22. So my patient today is going to be Miss Millie Larson, according to the MAR. I have her date of birth is 1/1/1963, medication record number. She has no known allergies. It looks like here she's going to be getting 2 milligrams IM of haloperidol. She's going to be getting Lispro 10 units sub-Q, and she's going to be getting a 50 milligram tablet orally of Docusate. And currently her medication is due right now. Okay, so I'm going to gather, if I were to go to, the Pyxis or wherever I'm going to gather my medications from. Start off, I always clean my hands. This will be my second check here, so we'll start off gathering all the supplies I need. I'm going to start with just my haloperidol, just because it's the first listed on the MAR, so I don't get out of order here. So I'm going to get my haloperidol, verify the correct medication here. I have that. She's going to get 2 milligrams of that. And then she's going to get 10 units of Lispro here. I have my Lispro, and then I have my insulin needle. I have her pill here. She is going to get Docusate 50 milligram oral tablet. And so now I have all of my medications and everything ready to go to the patient's room. Upon entering the patient's room, I'm going to perform my hand hygiene. I'm going to introduce myself. I just, I want to give the patient some privacy, ask them if I can shut the door. I'm going to ask them, their name and their date of birth, and I'm going to have them verbalize it and give it to me. Miss Millie Larson, 1/1/1936. Then I'm going to verify of what she said was correct, and that is who she is. And then I'm going to do my third and final medication check here. I'm going to draw up and get everything ready at her bedside. So my third check here is we always start with an oral medication. After I did all of that check, I'm going to get some hand sanitizer again, make sure my hands are clean. I'm going to take her pill that I placed in the cup. I'm going to verify that she is getting 50 milligram tablet orally by mouth of Docusate, and that is what I have here. So I'm going to go ahead and pop that pill out, dispose of my trash, and then, scan or mark depending on where we're at. I'm going to ask Miss Millie if she has any questions about this medication, and let her know that I am giving her her physician-ordered 50 milligram tablet of Docusate. I'm going to make sure, if I can, that she is sitting in a high collar position so she can, take the medication, provide her with water, and so forth. I will hand her the medication as long as she can, hold it safely and put it in her mouth. So that medication will have been given. I will dispose of my trash and be done. Next, I'm going to provide some more hand sanitizer care. Next, I'm going to talk to Miss Millie that I'm going to be giving her insulin. I'm going to, we still have privacy going on. I'm going to don some clean gloves. I'm going to ask Miss Millie if she has any questions about her insulin. I am going to prepare my site of injection. I will, me personally, I am going to clean the area with an alcohol pad, circling, from the center outwards. And then I might place my alcohol pad in that, little point of where I want it to mark it. I'll allow the site to dry. I'm going to be doing her left lower abdominal area. And so we're going to pretend this is Miss Millie's lower abdominal. I am going to do the final third check, and I'm going to draw up the solution with Lispro and insulin. You're going to want to gently rotate the bottle. I'm going to pop the cap. If there's a cap, if it's a multi-dose vial, obviously I'm going to date and time, and put my information for the brand new bottle. I'm going to take my alcohol wipe. I'm going to clean the top of the surface. of the vial. I'm going to take my insulin syringe. Miss Millie, per her MAR here, is going to be getting 10 units of insulin. So I will be pulling and drawing back up to the syringe to the 10 unit mark on here. I will remove the alcohol wipe, insert into the vial, deposit the air, and then I'm going to gently pull back 10 units of insulin and make sure that's correct. Make sure that there's no air in there and that my medication is correct. Like I said, I'm going to be using her lower abdominal area. I'm going to pinch the skin between, my thumb and index finger of my non-dominant hand. I'm going to hold the needle between my thumb and index finger here, like so. And then I'm going to slowly administer. I'm going to insert the needle. Like I said, I'm grabbing, it's hard to see here. I'm pinching the skin in between my thumb and index finger of my non-dominant hand. I'm going to slowly insert the needle at 45 to 90 degree angle into the skin. I will use my pointer finger to gently inject the medication into the patient, remove the needle slowly, let go of the skin. I'm going to engage the safety, and I'm going to dispose of my needle into my sharps container. If I need to, I will take my, my gauze. If there's any blood, I'll just gently, pat or apply pressure. Dispose of all my trash. Dispose of my gloves. And then, of course, do my hand hygiene again. Last medication that I'm going to administer to Miss Millie, according to her medication MAR, is she's going to be getting her haloperidol, 2 milligrams. So for this area, I'm going to assume for this IM injection site that this is going to be a vastus lateralis site. Essentially, I'm going to make a nice square here, rectangle, and I'm going to place one hand on the greater trochanter and the other against the lateral femoral condyle. And I'm going to finding like the third middle anterior lateral line of the thigh here. And that's where I'm going to apply the medication. So first I'm going to draw up though. So again, find my hand sanitizer. I'm going to don some clean gloves. I'm going to verify my medication again, haloperidol. She's going to be getting 2 milligrams IM. So I'm going to pop my cap, don my new alcohol wipe, clean the top of my haloperidol. I'm going to have a new syringe and dispose of that. And then I'm going to take my draw needle, making sure to be conscious to make sure the top's clean. I'm going to circle the top. I am going to draw back on here 2 milligrams. And then I'm going to insert the needle into the haloperidol, put the air in, and I'm going to draw up. And draw up my 2 milligrams of haloperidol. So I'll remove my needle. And I'm going to draw back here on the needle so all of the solution comes down and nothing is stuck up and the medication is not stuck up in the needle. I will safely recap my needle here. I will engage the safety actually with this one because I don't need to recap it. I will remove the needle, dispose of it into the sharps container, and then I will get ready for my administration needle here. Again, following the same procedures, making sure everything stays clean. This one is glued very well shut. Somebody at the manufacturing company didn't want us to get into this one. There we go. Making sure to make sure that I keep it clean here. I will apply my syringe and I will gently push back up to my 2 milligrams here. And I don't want to compress it all the way. So again, we're going to be on Miss Millie, I'm going to be using the vastus lateral site. I'm going to place one hand on the greater trochanter and the other against the lateral femoral condyle. Find that middle third anterior lateral thigh area. I'm going to find my site here, right here in the middle. I'm going to take my alcohol pad and again, circling from, from the center outwards. So I'm going to clean the site. Make sure that's clean here. And, I'll probably go ahead and lay my alcohol wipe, on the site that I'm going to give. So for a IM injection, you're going to want to allow the site to dry prior to administering it. You're going to, instead of pinching the skin, you're actually going to want to spread the skin taut between your thumb and index finger of your non-dominant hand. Okay? This time I'm going to take my syringe with my medication. I verified, that I'm giving Miss Larson 2 milligrams of haloperidol. That was my third and final check. I am going to, as I'm pulling the skin taut here, I am actually going to, for an IM injection between my thumb and index finger here, I am going to insert the needle at a 90-degree angle into the skin. And then I'm going to go ahead and slowly inject the medication, remove the needle, slowly engage the safety device on the needle, and then I'm going to dispose of the syringe into the sharps container. If there's anything residual or if there is any bleeding, again, I'll either take that gauze, I'll wipe, pat, make sure it's still not bleeding, dispose of all my stuff. I'm going to remove my gloves, and then I'm going to perform hand hygiene, washing my hands and getting everything clean. I'm going to make sure Miss Millie Larson is comfortable prior to leaving her room, and if she has any questions about after the procedure is complete.